Hi, I'm Dr. Molly with Your Goals Physical Therapy. Let's talk about whether or not you need to have an MRI before you come into physical therapy. In my opinion, the answer is no, and here's why. So, first, the difference between physical therapy and a surgeon, right? So, surgeons and your primary care physician, they use X-rays and MRIs to diagnose structural issues, right? And I mean, I would use it for the same thing, right? I mean, I'm going to look at the picture and know, okay, well, this is where some injury has occurred, and you can make a plan accordingly. Especially if I was going to go in as a surgeon, then I would need to know exactly what it is that I'm going to be doing surgery on and what it looks like so I can come up with a game plan. It'd be very important for me to at least have a general idea of what I'm going to go in and see. And if things change once you open somebody up, then things change, but at least you had a general idea going in. Now, in my world, what I've seen are things like this. So if I take two examples, so I received MRI reports from two different patients. It was actually the same week. So the first MRI was of a gentleman who used to clean the inside of cars. He did detail work for cars, and he had a 10 centimeter disc bulge, which that doesn't mean anything to anybody. I mean, it barely means anything to me, to be honest with you, but 10 centimeters is huge. Normally, bulges are measured in millimeters. So, that was a big difference. And in fact, that was so dramatic that I even called the doctor to find out if I was reading that correctly or if maybe that was a typo. It was a very large disc bulge that they found in this poor gentleman who at the time was in his early 30s. So I'm expecting to see somebody very devastated when he comes in. Now let's compare that to the second MRI that I'm talking about now. And that MRI, it was a very minor disc bulge, and per the report, it wasn't encroaching on any nerves, and so it really wasn't very big at all. So nobody was really expecting there to be a whole lot of dysfunction related to the disc bulge. But when they came in, I got very different stories. That gentleman barely noticed his discomfort. It just got really sore at the end of his day, and he was more annoyed by it than anything else. So that was a very different presentation. And so I was able to work with him on breathing techniques and stretching and working on some core stability and changing how he was moving in his environment to completely eliminate his pain. And it wasn't very long while he was in therapy because he didn't have a lot of pain, and he was able to do everything he wanted to do. So off he went. Now, this other woman who, based on the MRI report, only had a very small disc bulge, she came in, she's like hunched over. She couldn't handle deep breathing because it just set her lower back off. She had to have medication for muscle relaxers and other kind of things, and she still, even under severe medication, or not severe, a lot of medication, she wasn't able to tolerate much of anything because anything that moved her lower back just inflamed and agitated everything. So she ended up having to have surgery based on all of her symptoms. And so that's why MRI reports in where I'm at it is not necessarily the end all be all. And so I really do have to take a look at the person that's coming in and where your symptoms are. What happens when we bend this way? What happens when we bend that way? Does this make this better? Does it make it worse? What does it look like when you're moving around dynamically? What does it look like when you're sitting in a chair? What office activities bother you? What household activities bother you? So let's work through that. So if we do X, Y, and Z, does it make it better? If we do X, Y, and Z, does it make it worse? And so that way we can basically make everything as stable as it needs to be so that you can get back to all of your favorite activities. But the MRI is a great supplement for me, but it's definitely not something that is going to be a huge lead because your symptoms are going to be the big thing that I follow. So I hope that kind of answers the whole, do I need an MRI for physical therapy question. Anyway, I hope you're having a good day. Bye.